Hello everyone, I'm Srishti Laller and I'm presenting our research work here. Our topic is if metabolic syndrome is associated with risk of ischemic stroke in patients with non-valvular atrial fibrillation. Our study here had two main objectives. One was to find the prevalence of metabolic syndrome in patients with acute ischemic stroke among the non-valvular Afib. Secondary was to find the independent components of metabolic syndrome like obesity, diabetes, hypertension, high triglycerides, and low HDL, and those predict the acute ischemic stroke and compared with the CHA2DS score among the non-valvular atrial fibrillation. In our study, we have used cross-sectional study method, and we have also used the regression analysis to find the results. And what we have found in our results that among the 33 million hospitalizations with non-valvular atrial fib, 2.9% were due to the acute ischemic stroke. And among the acute ischemic stroke hospitalization, the prevalence of metabolic syndrome is 0.16% in comparison to non-acute ischemic stroke. And in the regression analysis, we have found that patients with metabolic syndrome and its component, they had higher risk of acute ischemic stroke. And through the CHA2DS score as well, we have found that beside hypertension and diabetes, the other components of CHA2DS score like age, sex, female, age from 65 to 74 and over 74, prior history of vascular disease or prior history of stroke, they had higher odds of acute ischemic stroke. And in conclusion, we can say that metabolic syndrome and its components, high triglycerides and low HDL, they are independent predictor of higher risk of acute ischemic stroke. Thank you, and I hope you enjoyed.